Okay, so this is a nutrition boot camp. So I'm going to try to give you all the information that you're going to need throughout nursing, the really important stuff, and kind of cut out the stuff that you don't really have to know. So let's start with, this is the biggest problem a lot of people have: vitamin K versus potassium, which is represented as a K with a positive sign after it. They are two different things, okay? Vitamin K is a vitamin. It's found in green leafy vegetables. And what it does is it helps with clotting. It helps your blood clot. So it's important for your liver to have a sufficient store of vitamin K. So this way, if there's an issue where you're in an accident or something and you're cut up bleeding, vitamin K is one of the essential things you need to help your blood clot. It's also important to know that warfarin, which is an anticoagulant, it's vitamin K is the antidote for that. Okay. So make sure that you know this stuff. This will be on the final. Okay. So that's why we're going over just the important stuff. So don't confuse vitamin K with potassium, which is K with a plus sign after it. Potassium's an electrolyte. Okay. And electrolytes are either positively charged or negatively charged, or neutral. Potassium happens to be positively charged. It's a cation. The blood level for potassium is 3.5 to 5.0. Okay, so 3.5 to 5. That is the serum level that your potassium should be. It's important to know that when we talk about potassium, the core word, the root word is kalemia. Okay, kalemia. So in other words, if I say hyperkalemia, then what I mean is I'm talking about potassium. Okay. So that is what that's about. I don't love this. Anyway, let me move this over here. Really? Okay, there we go. So after potassium, the next electrolyte that you need to know about, actually, I'm going to do sodium next. Sodium, good old salt. Okay. So sodium is represented as Na with a plus sign after it. Okay. When we talk about sodium, we say natremia. So hyper or hyponatremia. Hyper, of course, too much. Hypo, not enough. Just think about hypo, zero, little bit, less, too little. That's the way to remember hyper versus hypo. Okay. So, and sodium levels in your blood should be from 135 to 145. Okay. And you need to know that. The next electrolyte we're going to talk about is calcium. And when I'm done with these four, I'm going to give you a helpful hint about stuff. So calcium, represented as Ca with a plus sign after it. Therapeutic calcium level in the blood is 8 to 10. And when we talk about calcium, that one's easy. It's calcemia. Calcemia. Okay. Either hyper or hypocalcemia. And then the last one I'm going to talk about is magnesium. There we go, magnesium. And that is represented as an Mg with a plus sign after it. Notice how those four have the plus signs after them. They're all cations. They're all positively charged electrolytes. Magnesium therapeutic level is 1.5 to 2.5. Okay. And when we talk about magnesium, we say magnesemia. So it's either hyper or hypomagnesemia. Okay. Now I'm going to tell you one sentence that you're going to remember forever. So put this in your head. Okay. When you think potassium and sodium, you think muscle. When you think potassium and sodium, you think muscle. Okay. Potassium and sodium, muscle. When you think calcium and magnesium, you think nerves. When you think calcium and magnesium, you think nerves. And the reason is when people think calcium, they think bones, right? In your bones, calcium is important. When it's in your blood, it controls your nervous system. Okay. So calcium and magnesium directly affect how your nervous system responds. Potassium and sodium rather affect how your muscles get charged and innervated and do things. So potassium and sodium, you think muscle. Calcium, magnesium, you think nerves. Remember that. Okay. Now, when we talk about these electrolytes, it's important to know Again, make sure you don't confuse the K because that's a problem for a lot of people. Make sure you know hyper and hypo, and make sure you know potassium is kalemia, sodium is natremia. See how it starts with Na, right? Natremia. Calcium is calcemia. Magnesium is magnesemia. Okay. I want to talk about some other things that have to do with diet too. So let me move this stuff out of the way. I'm going to talk about lipids real quick. Lipids, which are fats. Okay, lipids are fats. When we check someone's blood, we check for cholesterol, total cholesterol. Total cholesterol should be less than 200. I mean, less than 200. And that is a certain type of fat that's in your blood. Okay. Your liver makes some cholesterol. So for some people that have hypercholesterolemia, and that's a mouthful to say, right? Hypercholesterolemia. Sometimes we can give them drugs. Statin drugs are the drugs that we usually will give people, right? Statin drugs. These are the ones that lower cholesterol. So sometimes we'll give them to patients, but then it won't work. Their cholesterol doesn't come down. And, sometimes it's just genetics, right? But your total cholesterol should be ideally less than 200. But more important when you look at labs, total cholesterol, yeah, but more important is what's the breakdown between the HDL and the LDL. HDL, high density lipoprotein. Just remember, H is healthy. That's the good cholesterol, right? That's the one that you want a lot of. The higher the number, the better. Minimally, it should be higher than 60, but the higher, the better. Okay. That's the good cholesterol. That's the one that actually sweeps through the arteries and gets rid of the bad cholesterol. And the bad cholesterol is LDL. That's the bad one. Okay. That's the one that builds up in your arteries, atherosclerotic plaque. There are two words that you need to know. Atherosclerotic plaque, and I'm going to write these down at the bottom here. When you see atherosclerotic versus arteriosclerotic, they kind of look alike. They really don't sound alike. Atherosclerotic is referring to the gunk that's inside the arteries that clogs them and stops the blood from getting through as quickly as it should. That's why that LDL, that's the one that does it. It builds up inside the artery. So if the artery is this big, right, normally, and the blood just goes through nice and easy, that's great. But if plaque builds up inside and the opening or the lumen of the artery starts to get narrow like that, well, then it's harder for the blood to get through. Blood pressure goes up, creates a lot of problems. That plaque can break off in hunks and it can move to different parts of the body, like your brain or your lungs or your coronary arteries on your heart, and give you a heart attack, a stroke, or a pulmonary embolism. So that's why these things are so important, because high cholesterol can kill you. Only it'll kill you slow. It ain't going to kill you fast, right? If you want to take yourself out, there's better ways to do it than to do it like this. So arteriosclerotic is hardening of the arteries. As we get old, and this is everybody else, not me, I don't have any of these problems. As we get older, the body ages, the parts inside age, just like a car, parts wear out. As we get older, the arteries, they're usually very elastic, they're flexible, they kind of get stiffer. That word is stenosed. Stenosed means stiffer, not as flexible, and not quite as wide as they used to be. And that can actually be bad because that can cause a heart attack. Again, different reasons for problems with the arteries, but outcome is almost the same, right? Because with arteriosclerosis, the arteries just get stiffer and the blood can't get through as easily, high blood pressure, yada, yada. Atherosclerosis, that's because the plaque is built up inside there. Okay, so just remember those two. Okay, so atherosclerotic, that's the plaque, right? And arteriosclerotic, that's stenosed because you're old from age. Okay, now back to these cholesterol levels. The LDL is the bad cholesterol. That's the one that you don't want. And that should be less than 100, ideally. Okay, then there's one more thing, triglycerides. Triglycerides, and they should be less than 100 also. It's just a different type of fat, a different type of lipid also found in the blood. If someone has high cholesterol and it's more of the bad than the good, you will usually see what goes hand in hand is high triglycerides also, right? And it usually has to do with two things, well, three things: diet, exercise level, and then genetics, right? But even if you have bad genetics, you can fight your genetics by doing things that are good for you, right? So you don't have to just, roll over and go, well, I got bad genes, so I guess I'm going to die young. No, right? You want to be active. You want to try to eat right. It doesn't even have to be perfect, but a reasonably good diet, right? That will help. Okay. Let's see. There are a couple other things I want to talk to you about, and you're going to need these later, but why not get started now? Okay. Now's as good a time as any. So I'm going to go over here and I'm going to talk about something called purine. Purine is found in foods. Okay. And purine is a problem because it equals increased uric acid. So increased uric acid. And uric acid, well, you say, why is that bad? It's bad because increased uric acid causes a disease called gout. If anybody's ever heard of gout, let me tell you, it's very painful. You'll see someone with very swollen extremities, usually from the foot up to the knee. Red, erythematous is red, right? Let's put some of these words up here so you know. Erythema, it means red. Okay, so know that word. Erythema is red. So their legs are red, they're swollen, they're painful. That's gout. Purine is found in foods like, they call gout the rich man's disease, which I always laughed about. Because back in the day, only rich people got gout, because only rich people could afford to eat lobster and oysters and scallops and like filet mignon and mashed potatoes with a lot of gravy. Those things have a lot of purine in them, so they cause gout. Okay. So that's that. And then I want to talk about tyramine. Oops. Let's start here. Tyramine. Tyramine is a problem for one particular type of antidepressant. I'm not going to even get into that because we're not into pharm yet. So this is a preliminary, this is just nutrition, but tyramine for people that are on a certain antidepressant, it's tricyclic or MAOIs, monoamine oxidase inhibitor antidepressants, like phenelzine is one example. If they eat foods with tyramine, their blood pressure will shoot up. They go into a hypertensive crisis, it's called. High blood pressure, tachycardia, okay? And tachycardia, let's do another word, tachycardia. Tachy means fast. Tachy means fast. Cardia is heartbeat. Tachycardia, fast heartbeat. They all have tachycardia, hypertension, and they will have also tachypnea. Tachypnea, which is rapid breathing, and pyrexia, which is a fever. They're going to have a fever. Where do we find tyramine? In all the delicious bar foods. So aged cheeses like blue cheese and Roquefort cheese and Parmesan. And it's found in dried beef like beef jerky or pepperoni, those types of things. And also avocados, also soy sauce, some examples of tyramine containing foods. So I'll put some of these up here: soy sauce, avocados, yada, yada. So make sure you know tyramine and where it's found, right? And I'm going to let you guys take a picture of this board, right? So because that's got more info on it. Purine, where it's found and that it causes gout. And the lipids, the total cholesterol, total triglycerides, HDL, LDL. Those electrolytes, start committing them to memory because we're going to start talking about all the different impacts that they have on the body. But, particularly potassium. Potassium is the queen mother of all the electrolytes. If your potassium is high or low, you're going to have a heart attack for different reasons, but you're going to have a heart attack because your heart has a muscle around it called the myocardium, and that's what makes it beat. Your heart's a pump. When your potassium is off, it throws off the rhythm of the heart. Heart attack. Okay. MI, a heart attack is an MI. Let me put that down here. It's a myocardial infarction, which is a fun word to say. That is a heart attack. Okay. And know your levels, your blood levels that I just went over, and know hyper and hypo, right? Remember, if something is hypo, when it's hypo, it's too low. Let's do that. That sounds good. That just came to me. Hypo means too low. Okay. And hyper is too high. Okay. And no, potassium is kalemia, sodium is natremia, calcium is calcemia, and magnesium is magnesemia. Okay. One more thing. Big thing with allergies. Everybody's got an allergy. I can't eat gluten. I can't eat wheat. I'm lactose intolerant, but latex. You will find that in a hospital or in any healthcare facility, latex is sneakily in a lot of stuff, not just gloves, IVs, right? And all the stuff that goes along with IVs. So latex is in a lot of places. If someone is allergic to latex, you should know an allergy to latex also means an allergy to bananas and kiwi fruit. Okay. Bananas and kiwi fruit. Okay. And that is all that I'm going to dump on everybody's head today. This will be on YouTube for all you guys and anybody else that wants to learn about some of the basic nursing nutrition items. Okay. Peace.